Hi, this is Emily, and here's my presentation. So, have you ever realized that every movement our body makes usually happens in pairs? In order for one muscle to contract and cause movement, another one needs to relax. These muscles that work together are known as antagonistic pairs, and are known to be the muscles responsible for joint movements. Today, I'm going to discuss some of these joint movements by demonstration from some antagonistic pairs. But to first do so, we need to understand that all directional terms are referring to a person in standard anatomical position so that the joints are assumed to be in zero position. Flexion and extension. This movement usually happens in the sagittal plane and refers to an increasing or decreasing the angle between two body parts. Flexion usually happens at the hinge joints. If we use, for example, bending your elbow, flexion would be the action that lifts your forearm from a 180 angle to a 90-degree angle. Extension would be counter that and lowering your forearm from that 90-degree angle to a 0 or 180. Like these baseball players, for example, notice how most of them have used their flexion action to hold their brownie. Protraction and retraction. Protraction describes the anterior movement that usually happens in the transverse plane. Your shoulder protracts when you need to push out over 90 degrees in front of you. For example, like these baseball players, see the one on his right? His arms raised into the transverse plane? Retraction would be the smart muscle action in this situation, since it is the posterior action of the protraction, when your arms would return from being over 90 degrees to once again resting again at 0. Circumduction and rotation. Circumduction can be defined as a controlled movement of a limb extending from a joint. One end is usually stationary, while the other end is making a circular motion, similar to the movement baseball and softball players do to gain momentum to pitch the ball. A 360 movement that is usually done in both the frontal and transverse planes. Rotation is a movement in which a bone spins on its longitude axis. This movement a pitcher would do when he doesn't want to change body positions, so they turn their head to check on first base, or turn it side to side when they don't agree with the catcher's signal. Abduction and adduction. Abducting would be stretching your arms out to your side and then directly up, where then adducting is bringing those limbs back down to your sides. When I think of antagonistic pair, this one particular, I think of jumping jacks. Plantar flexion and dorsiflexion are two movements, are actions used to describe the movement at the ankle. They refer to the two surfaces of the foot, the dorsum being the superior surface and the plantar as the sole of the foot. Dorsiflexion is a movement in which the toes are elevated. Athletes usually do this stretch where we usually do it when we walk to prevent our toes from being scraped or injured. Plantar flexion is a counter movement where the toes face down, an essential actions players need in order to jump. Elevation and depression. Elevation is a movement in a superior upwards direction, and depression refers to the movement in an inferior direction. It is a downward action that lowers a body part in the same place. Imagine lifting your shoulders to shrug, then lowering them back down in resting position. You just practiced elevation and depression. supination, and pronation are known primarily as forearm movements, where you turn your palm and forearm up. With your hand and elbow resting at a table in front of you, keeping your shoulder and elbow still, you turn your hand and forearm onto its back where your palm is facing up. Pronation is the opposite movement, causing the palm to face posteriorly. Again, keeping your elbow and shoulder still as you flip your hand and forearm down. This is the prone position.